Hello. Thank you so much for a warm introduction. I'm happy to be here and be part of this very important discussion, important collaboration. The questions are very important for both the Nordic region and the Baltic region and for our cooperation. We have very much in common. Uliana Hellberg is my name. I'm a project manager at Swedish Agency for Health Technology Assessment and Assessment of Social Services. I'm going to present the results of our scoping review of governmental reports in Nordic countries, with a specific focus on evidence-based interventions for preventing juvenile delinquency within social care. A couple of words about SBU at first. SBU is a state agency, and we work with assessments and evaluation of different interventions used in healthcare, dental care, and social services. We evaluate as well the associations between exposures in the workplace and employee health. Our usual target groups are people working in healthcare, dental care, and social services, and those who organize and plan how the services are provided. That is both professionals and decision makers. We usually say about researchers and those who finance research as our target groups, as well as patients and patient social network, which are affected by our results in a more indirect way. But in this case is our main focus on social services and social care interventions in the scoping review, which was commissioned by Swedish government, the Swedish Ministry of Health and Social Services. The main objective of this review was to present the scope of the Nordic reports assessing evidence-based interventions to prevent juvenile delinquency. We have also described the scope and content of these reports, but even the differences and similarities between different Nordic countries. And we have presented suitable domains for sharing Nordic experience, but these are questions and domains and interventions that can be interesting in more broad international context. The target audience for this scoping review is mainly policymakers, government officials, and national authorities who make informed decisions, and professionals as well who choose evidence-based interventions that can be implemented in practical care. We have highlighted common Nordic challenges in order to facilitate discussion on possibilities to overcome these challenges. It should be mentioned as well that we haven't assessed the efficacy of these interventions on our own. We refer to the Nordic reports which have made this. That's why our scope review doesn't provide any support or guidance regarding what methods or what interventions work or do not work in crime prevention. But because we show very broad spectrum of these different interventions during quite long period of time, this report can serve as a tool for both planning interventions and assessing the interventions in the field. I would also like to mention that both the planning and the execution of the scope review has been conducted in very broad collaboration with researchers and experts in the field of juvenile delinquency from very different perspectives, both in Sweden and our Nordic partners, experts. And we have searched reports up until June 2023 on several Nordic websites based on the information about which authorities that work with these questions in each country. So quite broad. We have identified about 300 reports in the beginning, which we read through. Our report, our scope review, was published in December 2023 and has been translated to English. So if you're interested in some more details, there is this report on our website as well as different supplementary files with more detailed information. And I can also say that this collaboration was quite essential from the very beginning, because we have noticed that there is no common understanding or common definition of some very crucial aspects. For instance, juvenile delinquency, crime prevention, social interventions. So together with our partners, we have defined these key terms. And we had to do this in order to make some delimitation in our reviews. There are very many good reports, but we had to include something that was most relevant so we can be able to answer our questions. So when it comes to juvenile delinquency, we define it as individuals, often up to 18 years of age, who demonstrate a pattern of criminal activity regarding intervention, and requiring intervention from the whole society. Crime prevention is quite a broad definition here, but we were trying to identify actually everything that can describe preventive measures in order to prevent emergence, entrenchment, or persistence of juvenile delinquency. And this can be about intervention targeting all individuals in the population, or very specific risk groups, or individuals at increased risk, or individuals with already established criminal problems. Social interventions can be those with the objective to change, detect, or modify risk behavior or risk factors, but even those which aimed at strengthening the protective factors, and can be both in the individual or the individual social network, family, peers, parents, siblings, and so on. And when it comes to the national reports on evidence-based interventions, which we included in our review, we decided to include those that provide guidance for the local level in choosing evidence-based interventions, and those that review and synthesize pre-existing knowledge about the efficacy of interventions. So we had to exclude those reports that didn't provide synthesized knowledge, that didn't describe some effect of some intervention, for instance. So after we read through about 300 different reports, we have decided to include 30 reports which were relevant for our questions, for our scoping review. And you can see the numbers, how it looked like in the Nordic countries. If we excluded something, it doesn't mean that it was of some bad methodological quality, it's just because it didn't correspond to our inclusion criteria. We had to exclude many reports which described juvenile delinquency in general, described the prevalence of juvenile delinquency in the population, but didn't describe, for instance, an intervention in order to prevent juvenile delinquency. And we had to exclude very many and very good primary studies, that is, those based on quite new knowledge that didn't synthesize the effect of the interventions in general. And in these 30 reports, we could observe a very broad spectrum of preventive social approaches. It could be those directed to parents-to-be, children and families, adolescents and young adults, in very different settings. So social interventions provided within social care, but even within institutional care or residential care, within civil society, schools or preschools, and healthcare. And we have identified very many interventions in order to develop skills, individual skills, or parenting skills, for instance, interventions to educate parents, interventions to strengthen family relations, create a positive environment, and facilitate education and employment. Most interventions were directed to adolescents and young adults within social care, and with the aim to develop individual skills or parental skills or strengthen family relations. In general, in these 30 reports, which we included in our scope review, we have identified 51 unique interventions, which were described as knowledge-based by the authors of these different Nordic reports. Here you can see that the range of the interventions was quite wide, and the interventions could be directed to different subgroups of individuals, provided in very different contexts with different preventive aims. When we started to categorize these different interventions, we have noticed quite early a big variety in preventive strategies. It could be interventions in order to prevent the development of juvenile delinquency. In a very broad population, could be general public or whole population, regardless. Could be, for instance, interventions provided to preschool children in general or to school classes. And doesn't matter if their pupils in school classes were at risk or didn't show any risk factors in developing juvenile delinquency. But it could be also interventions provided to individuals or groups with risk of developing delinquency. The next aim, which was quite clear among the interventions we have identified, is to prevent transition to established juvenile delinquency. Intervention could be given to individuals with early manifestation of delinquency in this case. And quite many reports were about preventing relapse and deterioration, that is given to individuals who already established in juvenile delinquency, who already showed pattern of criminal activity. And here you can see how the spreading looked like between the Nordic countries. You can see, for instance, that there are quite many reports from Denmark, quite many reports from Sweden targeting individuals who already established in delinquency. Not so many reports in general, which described interventions given to broader groups, regardless of the risk factors. More detailed, and this information also you can get from our report in more details, but it's important to mention that according to the authors of these reports, there are some mechanisms that can lead to change. It means that preventive methods within social care are usually based on some specific theory or specific mechanisms or elements which can induce change in the individual, which in turn can reduce the inclination to commit crime. So here you can see that there are very many reports from all Nordic countries, which we included in the scope review, which were about family relationships, developing parenting skills, as well as individual skills and capabilities. So these were the main mechanisms that could lead to change, that could induce a change in criminal activity, criminal behavior. A bit fewer reports were about education and employment, modifying the school environment or supporting adolescents and young people in vocational training, gaining work experience and daily activities. Quite many reports from Denmark in this case. Some few reports were about leisure and peers, that is, developing organized activities in order to create some sense of coherence for a child or a young person, for example, through sport activities. And some reports were about mentorship, standardized assessment tools, and mediation. So these were described as mechanisms in the intervention that can be crucial in order to reach some effect for a specific subgroup. At the same time, we have to mention that there are interventions that can lead to the change and a specific effect. But we have to keep in mind that there are some interventions which are effective for a very specific population. And here you can see some examples: treatment foster care, functional family therapy, cognitive behavioral therapy. These international interventions can be given for instance, to adolescents 12 to 17 years of age. These interventions can be effective in different ways. It means that they're not necessarily effective for small children or young adults, but it can also mean that there is need for more research for us to be able to say that these interventions can be effective for other groups as well. According to the authors of these reports, it's also important to keep in mind that some specific conditions are required in order for an intervention to be effective and successful. It's often about collaboration between different organizations, for instance, social care and residential care, law enforcement authorities, healthcare, and so on. Family and social network involvement can also be crucial in some cases, but even such aspects as duration, intensity, long-term planning can be very important in order to reach the change and the effect. In some cases, some authors of the reports have emphasized that the knowledge base is not sufficient to draw a definite conclusion regarding the efficacy of some interventions. One good example of this is victim-offender mediation. It doesn't mean that the intervention is not effective. It means that the more research is needed. And one more domain, last but not the least, some interventions are ineffective or can even be counterproductive or harmful. For instance, institutionalization without concurrent support. This is one of the domains with a lack of national guidance on effective intervention. Is institutional care or residential care when a child or a young person is placed without any other interventions are provided. This is particularly important since institutionalization in one form or another is used in all Nordic countries, and institutionalization without concurrent support may lead even to increased risk of recidivism. So providing effective interventions to prevent recidivism during institutional care is therefore quite crucial for preventing juvenile delinquency. So based on all these results and observations and our analysis, we have identified 3 so-called knowledge gaps, which are common for all Nordic countries. There is a lack of research on interventions aimed to prevent recidivism for children who commit serious crimes. And by this, I mean children under the age of 12. As I've mentioned, there is a lack of research on interventions intended to be provided within institutional care. And there is lack of reports on interventions directed to the whole population or population groups. So these are knowledge gaps which can be discussed and addressed in cooperation between the Nordic countries and in more broad international context. We have also noticed some challenges, such as, for instance, finding a common understanding of what constitutes evidence-based interventions, because there are different interpretations and different definitions of what evidence-based is. We see that it's important to communicate the importance of supporting factors, such as collaboration, for instance. At the same time, the supportive factors cannot replace the accessibility to evidence-based interventions, manual-based interventions, which can be implemented in practical care. And we see also the need to broaden the perspective of what constitutes crime prevention in social care. Because here we could see as well that there is no common definition or understanding what is juvenile, what is delinquency, what is social intervention, what is crime prevention, and so on. So if we discuss and if we overcome these challenges, we believe that it can contribute more efficiently to a knowledge-based approach in social care. But despite all these challenges, we could also notice possibilities for the future research, for the future practice. We have seen very good practice-based research. which was conducted in the international context, and it's very good because it increases the chance for good cooperation and learning. We have identified research on the implementation of new interventions, and we could also see an advantage when researchers involve users and professionals in prioritizing research questions and addressing knowledge gaps in a common way. So there is knowledge, and there are multiple national reports which have been published about knowledge-based interventions with the aim to guide professionals and guide decision makers in social care to choose evidence-based interventions. What can be done more? Strengthening the dissemination of knowledge to support implementation and support further research. Thank you so much.